Stay in the know with Radio 2000 podcast.
The National Health Insurance, a long-promised initiative to provide universal health care coverage. Is it likely to happen? How is the state of readiness in that regard? There was a press briefing yesterday by Minister of Health and Motsoaledi, really addressing the media with regards to, I think, largely to do with an article that was written in this weekend's papers. Well, he's here to clarify and also give us a sense of the state of readiness of government in implementing NHI rather. Rewe, dumela le kae?
David Lekai.
We well, man. We hope everything is okay. The year is starting on a high note for you, I hope.
Yeah, well, under the circumstances, yes.
Yes, and I wish you well for 2025. Yesterday, you were addressing the media. What were some of the highlights that matter for us to acknowledge in that regard? I hear you speaking of misinformation and all of that. What do you want to clarify in that regard?
No. I was not addressing the media. I issued a media statement. In other words, I was not with the media. I issued a media statement.
Okay.
Because over the weekend, there was an article in City Press Online where they are saying, for instance, the headline is ANC going to force medical aid schemes to be cheaper. And then in the article, they are making allegations of proposals, which they claim are going to be made by ANC and the department as a compromise to NHI in order to appease the partners in the government of national unity, in the GNU, especially the DA. They say we are going to appease them by making serious concessions or alternatives, and they are making proposals of those. Now, there's nothing like that, and they say this information comes from reliable sources within ANC government, reliable sources, as they say. Now, such proposals are not on the table. At least they are not on the table from our side. We are going to make no such proposals, either from ANC and government. And we found it a misleading article, and we thought we needed to respond and made it clear that there is no such a thing. But we also wanted to respond to the heading about ANC going to force medical aids to be cheaper.
Yeah.
Yes. Now, our response was that everybody knows the price of private health care. I'm sure you also know. Because you know that is running away. It's getting out of reach of many people.
That's true.
We worried. You know that medical aids this year are increasing their premiums by up to 10%. With GEMS actually moving to 13%, which is a big sting to people's pocket. We all know that. But we are saying it's unfortunate for the person who wrote that story to claim that we are going to solve that by just forcing medical aid to reduce their prices. Because number one, by what mechanism do you force medical aid? But number two, and even more important, to what end? Because everybody who we write in the article that even with a rudimentary knowledge of how private health care works, you will know that there is no problem. The problem is not there. It's not there about forcing medical aid scheme, because it's a very, very complex thing. We now say this issue about the cost in private health care is not just in the form of anecdotes and hearsay. We put a commission which worked for 6 years, a health market inquiry through the Competition Commission, which was chaired by an eminent jurist, former Chief Justice Ngobo, with four other eminent specialists and academics, and it took 6 years. And the people who came to give evidence at the commission were international experts, were local experts, even private sector in South Africa itself participated. That commission has got a report with recommendations, and I said in the next few weeks I'm going to come out in a press conference to tell people what is the way forward about those recommendations. Now, I was saying, when you write articles about that, you ought to read such articles, because, such what you call documents, because they are public. How then do we put up a market inquiry for 6 years. It makes recommendation, and we rush and make a different recommendation at all, which does not make sense. We are even going further to say anybody who with a rudimentary knowledge of private health care will know that the proposal that they are talking about is actually a dump proposal, which means if it comes from us, then we are regarded as dump, and that's why we thought this needs to be corrected.
Let us focus on the real issues. Do you have a deadline on when you would ideally want to implement the national health insurance?
In the Act itself, David, it mentioned various phases, and we repeated many times that national health insurance is not going to be an event.
Okay.
It's going to be a process which will take many years or even a lifetime, because there's no time when you stop making changes in the implementation of NHI. No country has ever stopped. The British started in 1948. They are still making changes even now. Even our own medical aids, David, I'm sure you are aware, the first proposals to establish medical aids in South Africa was in 1967. Even now, as I'm talking, medical aids are still implementing, if you understand what I mean. They can't say we've finished implementing the whole process of private healthcare and medical aids. They are implementing continuously, making changes, coming up with new things, etc. And that's exactly how NHI is going to be.
When you anticipate the beginning of this process, as you call it, clearly there are some hurdles that you're likely to come across, and one could be just the general state of healthcare and its ability to carry what will be an implementation of something that will require a healthcare system that works very differently. What are some of the stumbling blocks maybe that are key to you that will delay or slow down the pace of the implementation?
Let me put it this way. It looks like part of the misunderstanding in the country is exactly the definition of NHI. Quite a number of people believe NHI is a type of a healthcare system, which is a vintage healthcare system above what you are having. And for that to happen, you need to have vintage hospitals first, and you need to have all the doctors and nurses you need. You need to have all the equipment. In other words, you need to be very rich. Then you implement NHI. That's understanding of many people. Whereas the opposite is actually true. Remember, NHI is not necessarily just our concept. It's a global concept. To do what? Because the World Health Organization has said every healthcare system in the country has got 4 pillars, 4 strong pillars, but they call them building blocks. They are cardinal pillars of the healthcare system. One of them is healthcare financing. And they said the other pillars will actually shake if you don't get this one of healthcare financing right. And it so happened that around the world, that's where the problem is. But it's worse in countries like South Africa, where we have got inequitable financing of healthcare system. Now, NHI is a healthcare financing system that will do 2 things. Number one, that will make sure that everybody, regardless of their socioeconomic status, is entitled to good quality health care. I'm sure everybody knows that. But it goes on to say, but when you get that good quality health care, you should not experience financial hardships, what the World Health Organization called catastrophic healthcare expenditure. Because they are saying, even if there's access to healthcare in many countries, especially in countries like South Africa, but the problem is to access it, you need money. And many people, just out of being sick, have been declared poor. They've gone into poverty, that I'm lying, in many countries, and that in South Africa is ongoing. So that's why they came with a concept of universal health coverage, that everybody must be covered regardless of their socioeconomic status. In South Africa, we then call it NHI. And you know, at the moment, David, the people who are covered are people who are well off, who are better off. I'm sure you understand what I mean.
100%.
It's me and you who have got medical aids, who get this good quality health care because we are covered. But what about other South Africans?
I want to carry on, and particularly on the point you just made. However, I want to ask this as my last question. Those that don't seem to support what sounds like an ideal scenario or universal health coverage, what are their main issues, really, as we conclude?
Quite a number believe we are going to destroy private health care, which is not true, but they believe so. All we are saying, we say we want equity. Because, David, let me give you these figures. Should you, I'm even asking you as a South African, should we go on with a scheme whereby at the moment, because they say we are going to destroy medical aid, they are doing very well. But what they are not telling the public is that only 10% of the African population are covered by medical aid, as opposed to 72% of the white population. And I want to repeat that. We are running a system whereby only 10% of the black population, let me put it that way, are covered by medical aid. 90% are not. In the white community, it's 72%. At least they are better off, but there are still whites who are not covered. What do we do with them? Do we continue with that system, which is so expensive and only guaranteeing, when you look totally in the whole population, it guarantees good healthcare system to only 14% of the population? Should we go along with that type of system? Or can we come up with something that sort of covers everybody? Because we keep on talking about equity in the country, and we talk about inclusive growth. That's what we're talking about.
Yes. And there's a point you raised earlier when you said, the quality of the healthcare is better in other sectors of our community, and some is not. But that is the responsibility of government, isn't it? Shouldn't we be working harder to improve that side?
Absolutely.
Yes.
Absolutely. You are 100% correct. And that's what exactly we want to achieve, with NHI want to do. Because to do that, you also need resources. David, I don't want to waste your time. You saw matric results yesterday.
Yes.
Yes, there was constant and persistent investment in education in poorer areas of the country. You heard the comments that the areas that are coming up improving very fast are areas from previously disadvantaged communities and rural areas, schools that are no-fee schools. Don't think that thing just came rolling on the wheels of inevitability. There was
it's not a miracle.
It's not a miracle. There was a deliberate action to invest. Now, in the healthcare system is the opposite. The investment is perpetually happening in the area of private healthcare, catering for 14% of the population. And in the remaining 86% of the population, there is active disinvestment. Let me just give you two examples. At the moment, most private hospitals are funded by PIC to put world-class infrastructure and equipment. I have been struggling for 10 years from Treasury to allow us also to get money from PIC, which will pay over a period of 30 to 20 years. Put world-class hospitals so that even the poor can have such facilities. You understand what I'm trying to say?
100%.
And that's what we are emphasizing in NHI. Then comes the issue of subsidy, which most members of the public don't know, because they keep on saying you are interfering with private health care. The state, this government I belong to, is subsidizing private health care for 100 billion rand every year. The money that goes to subsidize people who are in charge. Even the president asked me one day a question. He said, Minister, this subsidy that are given to everybody working for the state, such heavy subsidies, why am I getting it as the president of the country? Because I can take care of myself. I said, right, President, that's what we want to change. Because the subsidies goes to what? Those who are working for the state. That includes members of parliament, ministers, deputy ministers. It includes judges. It includes magistrates. It includes CEOs of companies. Those are people who are well-to-do in the world, but we are giving them heavy subsidies. With money from where? From the poor. Now, this week, something happened that was clearly very heavy for me. David, doctors marched because they can't get employment, because we don't have money to employ them. because we experienced serious budget cuts. In the same week, David, I was sitting in the meeting, which is called mandating committee, where we are discussing the increases of salaries with the unions. And one main agenda item is the subsidy for medical aids. Every state employee who's already working to get a higher subsidy for medical aid. And guess what? In the discussion, it's not going to be increased by consumer price index, no, by medical price index, what they call NPI. Do you know what NPI is? Medical price index. State South Africa say this year it is going to be up to 9.5%, when CPI is only 4.5%. PwC says it's going to be 7.2% when consumer price index is only 1%. Now, it's happening in the same week where the state is saying, for those who are well-to-do and employed, I'm going to increase their subsidies substantially. But for those who are unemployed, I've got nothing for them. How should I fold my arms with such a system and keep quiet?
Motsoaledi, I'm inviting you, and I'm doing it here on the radio, against better advice, for us to have a much longer conversation on these issues. And I'm inviting you now on air. There is a different platform where we have much longer conversations, because what you have to tell us is important. And I hope that you will make time for that invitation. With Leti, we'll coordinate that. So, thank you for sharing. It's a lot of information that we will be processing, and we appreciate the time you've given us. Thank you very much. I'll be watching the space for that invitation, because that's what we need to give people all the facts and the truth. Thank you so much. Again, Dr. Aaron Motsoaledi, a conversation that clearly matters to us. It's probably why we gave it so much time. Misinformation on national health insurance is one that is part of it. I remember during elections they said, from now on you can go to any private hospital. You'll get free medical aid, free medical help. And obviously there's nothing like that. You see, that's the problem.
If you missed it, catch the rewind on radio2000.co.za.